In this video, I'll discuss 6 reasons why your hand eczema may not be turning around, may not be responding to treatment, may not be improving as you are expecting and hoping it would. Before we get started, I'd like to thank everyone who purchased, read, and benefited from my best-selling book, Sick Skin: Skincare Made Simple. Pick up your copy at Amazon Books at the link below or to my side. Now let's get on with the video. So hand eczema is a pretty common problem that many people deal with. It consists of itchy, red, flaky areas on the hands, on the fingers. It can sometimes lead to bubbles on the side of the fingers. It could lead to scaliness on the hands and on the fingers. And in very severe cases, it can lead to fissures or cuts on the fingers, which can be very painful, and can lead to a vicious cycle where external elements or external triggers seep into the skin while it's trying to heal itself and undermine the healing process. Even if you're actively being treated by a medication, these fissures or cuts can actually undermine the healing of your own hand eczema. But there are additional factors that could be slowing down or even reversing the work that you're doing. Now let's discuss the leading 6 factors of non-healing hand eczema. So one of the main reasons for hand eczema not to heal properly is because you have not stopped coming in contact with whatever is causing your hand eczema in the first place. Whether it's allergic contact dermatitis or hand eczema or irritant contact eczema, allergic contact being you're coming in contact with which the immune system is triggered, or irritant contact dermatitis, you're coming in contact with something that irritates the skin or is toxic to the skin. In either case, continuous contact with the offending agent, and in some cases, several agents, both irritants and allergens, could be a serious problem that could make your hand eczema persist no matter what it is that you do and how good you are with all the other measures that are supposed to treat hand eczema, including moisturization and treatment, consistent treatment with the medication with which you were prescribed. The second reason for hand eczema not to be turning around is persistence of previous habits and practices that landed you in hot water in the first place. What do I mean by that? Well, if you're in the habit of washing your hands excessively, meaning every time you pass by a sink, you wash your hands with hot water and soap, every time you pass by a dispenser of an antiseptic or a disinfectant or an antibacterial foam or any one product that is supposed to disinfect your hands, you're actually digging yourself deeper into the hole, and your hand eczema is being undermined and being made worse by these products. They are invariably irritating products, even the ones that are important for your professional work. If you're in a healthcare setting, I understand. You will need to wash your hands. If you're in the food industry, you will need to wash your hands. You will need to disinfect your hands. However, you have to do everything in moderation. So do nothing out of habit or perfunctorily. You have to do everything with intentions. So if you have hand eczema, you cannot wash your hands just for the sake of washing. So stay away from that. You cannot scrub your hands. Certainly do not use hot water. Watch the soap you're using and make sure it is dye and scent free. It is not antibacterial soap, as those are not really beneficial in any way and can lead to further irritation of the skin. Reason number 3, you're using the wrong moisturizer. Many of us out there are under the impression that all moisturizers are alike. That cannot be farther from the truth. The truth is that there are very few moisturizers that actually give you clear and consistent benefit for moisturizing your skin, and those are far and few apart. Some of the leading moisturizers that I recommend on my show are white petroleum jelly or my moisturizing vegan balms. Now those are greasy moisturizers. They need to be applied very specifically. The way to apply those moisturizers, still get your bang for your buck and not get to stain your entire life, your clothes, your sheets, your loved ones, is to apply a drop size amount over the affected areas and spread it out as far as you can. And for a live demonstration of that, watch my video on how to properly apply a moisturizer at the link. What I also want to stress is that you cannot juggle moisturizers when you treat hand eczema. You have to pick the best one and you have to stick with it, knowing exactly how to apply it. The juggling method where you just kind of go back and forth between moisturizers. You have the Aquaphor, you have the CeraVe, you have the Aveeno, you have this, you have that. Don't do that. Don't waste your time or money. Pick the best moisturizer, use it consistently on the skin, know how to use it so you get the best benefit, and do not get the annoying side effects of the moisturization element. Use it consistently and get the benefit that you need. Reason number 4 happens when someone actually uses either the wrong strength of medication, meaning a medication that is too weak to treat the hand eczema, as in a topical steroid, whose strength is not enough to address the inflammation, the degree of inflammation or the thickness of the skin that's being treated. And a slight variation of that would be not enough application of the correct medication. So you're basically not getting the velocity of treatment that you need to resolve the issue and get it out of the way. So make sure when you treat hand eczema that you're actually using the correct strength of medication, that you're using it twice a day as directed until things improve and go away, and then stop using it, obviously, when things resolve completely, sticking to basic skincare, avoidance of undermining of your skin, and proper moisturization to prevent future occurrences of hand eczema. Reason number 5 is for the cowboys and cowgirls out there who add their own sprinkle, their own little thing onto the prescribed treatment. What does that mean? People who like to add antibiotic creams, antibiotic ointments, people who like to add antifungals, people like to sprinkle some essential oils onto the treatment. And those elements, while they seem innocuous, they seem harmless, they're potentially explosive elements. Why is that? Many of those ingredients can actually cause irritant or allergic contact dermatitis on their own. And the benefit of these products is dubious at best, because allergic contact or irritant contact dermatitis is not an infectious process for the most part. There are very rare cases where irritant contact dermatitis could be associated with bacterial overgrowth, but that needs to be proven by culture, addressed specifically to treat the bacterium in question. And then you need to back away from the antibiotic treatment and continue with treating the actual irritation with proper skincare and topical steroids. So do not add your own take onto the treatment. Stick to the bare minimum that needs to be done. This is not laziness. This is focus. You need to watch what you do to the skin. Take care not to do any harm. Do the bare minimum to take care of the skin as it needs to be taken care of, and then treat the problem actively with the medication as prescribed, watching the time frame to make sure you're getting the results that you need at the expected time frame that you set with your doctor. Now, reason number 6 is sort of a hidden Trojan horse blind spot of eczema treatment. Some people who have hand eczema actually have a steroid allergy, or they could have propylene glycol allergy. Propylene glycol is an ingredient that's incorporated into many skincare products, including topical medications. Now, if you're allergic to the steroid you're using on the hands to calm down the irritation, or you're allergic to one of the ingredients in the topical vehicle, you could be getting some pushback against your treatment. You could be getting some improvement in your condition, but as soon as you withdraw the medication, or sometimes while you're using the medication, you could be getting those waves of worsening and improvement, worsening and improvement. And that's a clear sign that something is disrupting or undermining the healing process or the calming down of the inflammation. Now, if that's a consistent feature of your hand eczema treatment, if you're getting pushback from the skin for treating the eczema, for the eczema to improve, you may want to ask your dermatologist to look into that and consider the possibility of a steroid allergy or propylene glycol allergy or other types of topical product allergies that could be undermining your own work, could be slowing down, or even worsening your condition while you're trying to treat and get better. If you enjoyed this video, share, like, and subscribe. Tell me in the comments section, are you dealing with hand eczema? Is your hand eczema slow to respond, slow to heal, slow to turn around? What do you think are some of the reasons that could be causing that? I'd love to hear from you. Tell me in the comments section what could be possibly going wrong with your hand eczema. Well, I certainly hope you benefited from this video. Thank you so much for watching. More great content coming your way right from this channel. Thanks for watching, and God bless.